Same. We all, I
Yeah.
mean, we're human beings. We need
Yeah.
those hormones forever from fetus to death. We
Yeah.
are synthesizing steroid hormones. So, no, these are the same principles apply.
Perfect.
Yes, definitely. I would give women more fat
Yeah.
than men. It's a difference of 5 to 10%, but it depends
Yeah.
on what you're doing. If a woman says I'm lifting heavy, I'm going to say, yeah, I mean, you want to be sure that you're eating enough protein.
Mhm.
But I think that we want to get to the point where we can just listen to the hunger cues, and when there's more stress, you're going to want more fat. When you have less, or you're going to the gym, those days you might want more protein. It really, when you can hear, when you've removed the stimulants, when you've removed the foods that are raising your cortisol levels or causing inflammation, you can hear what your body's saying better. You can
Mhm.
say, you can feel, oh, I want to reach more for some more butter today because it's going to make me calm down. It's going to make me address the stress that I'm experiencing at this time better. Well, I usually for women or any kind of I call it an anti-inflammatory protocol.
Mhm.
I'm doing 80-20. I'm giving people
Mhm.
80-20. Depends upon,
Mhm.
obviously, it depends upon their height. It depends upon, their height primarily, their structure.
Mhm.
So we know that 80-20 is they're going to be in ketosis and they're not going to be hungry. I was usually for men, I do 75-25 or maybe 70-30, depends upon the situation. I would say it starts in adolescence. There are many children who have, just to give you an example, a hypothyroid mother is going to have a child who is possibly, if she's hypothyroid during her pregnancy, and
Mhm.
it's not caught because they're just testing TSH and free T4, right?
Mhm.
Or they're just testing T4 and TSH. I've had so many patients who were pregnant and were afterwards they had postpartum depression, they had issues during during delivery, all because of being hypothyroid, or they had the hemorrhaging
Mhm.
right as when they were giving birth, they they couldn't stop the bleeding. They get hysterectomies. It's really sad. So,
Mhm.
but all this is due to being hypothyroid. So those children may be predisposed to ward during adolescence because that is when you need more thyroid hormone. May
Yeah.
be predisposed to ward. Possibly when things get more difficult, more nutritionally expensive, shall we say, they need some support. So I mean, one drop for a child is absolutely fine. Iodine is excreted via the urine, it comes through the urine, so it's not something you have to worry about. It's an essential nutrient. Well, TSH is not a very good measure
Mhm.
because only, that the T4 and T3, T4 is converted into T3, and that conversion is done by deiodinases, right? So certain tissues, D1 tissues, D1 to have D1 and certain other tissues have D2. So the TSH is really only communicating to certain tissues,
Mhm.
kidney tissue, musculoskeletal tissue. There's a bunch of other tissues that aren't using TSH to communicate to the thyroid. So it's a flawed measure from the get-go.
What are some of
Mhm.
the different minerals and nutrients that you might look for in a patient to see how to best support them?
I don't. I just make them eat a carnivore
They can
diet.
go even
They're
better.
all in, they're all in our meat. Why should we? So, for example, selenium is very easily toxic.
Mhm.
Too much selenium will
Yeah.
prevent hormone conversion. So people are popping 200 micrograms
Mhm.
and they're eating Brazil nuts.
Yeah.
Brazil nuts are horrible. So it
Yeah,
depends
bad.
on where the soil, certain trees have more selenium than other trees, nuts, right? It's like tea. Why tea is so bad? Because the tea plants are grown in fluoride-rich soil, which prevents iodine absorption.
Mhm.
So the body is looking for these minerals in meat. It's not looking for Brazil nuts, selenium, or zinc from, I don't know what kind of supplement company made it.